I think, where should I start? I'll start with the questions more about like trying to understand invariability a bit better.
Yeah.
So with pressure in particular, like you mentioned natural or loss in responsiveness that we have to abrasive hard surfaces and those types of pressures. So what would be one type of like natural response the body has that we maybe lose?
So if the thing I see very frequently is just the sitting surfaces that we take on a regular basis, right? So think about sitting in a couch versus sitting on a chair, or sorry, sitting on the ground versus sitting on a couch,
Yeah.
right? So it becomes very common in our culture to sit on more and more comfortable, like cushiony surfaces.
Yeah.
And that becomes the norm. Same thing with sleeping and lying down, right? The norm is sort of what's the most comfortable thing for us because we're going to be spending a lot of time there. And that's a worthy thing to venture for, is like what's comfortable. But just to know if that becomes the norm, like there's no other straying from that, we lose the ability to tolerate sitting on the ground. Like that becomes really uncomfortable. And that's something that can be trained, but you can't just throw yourself into it. So what you like with variability, there's sort of two things that you see. It's like that you lose tolerance, and anytime you try to force yourself back into something that you know you're sort of losing tolerance to, you can hurt yourself if you do it too quickly. So whenever we're talking about variability, we have to make sure we're talking about progressive adaptation as well, and like desensitization, things like that. So you can look at the sitting positions or sleeping, surfaces that you utilize or that we utilize as a culture. You can also look at footwear, right? So some people just have no tolerance for being barefoot because they're used to more and more support in their shoes, and some people have a lot of tolerance for being barefoot. But that's something that for many people can be trainable, right? It just has to be a gradual process. So I don't think of it as like a duality where it's like, okay, it's better to be barefoot or it's better to have like more supportive shoes. It's really whatever the person needs. But the reality is if you are always supporting your feet with more and more, you're losing the variability of the sensation, to actually even having your foot move in as many angles as you would if you were barefoot. So it's a good sign if someone can tolerate being barefoot, right? It tells that they have more options now than if they have to be locked into like a specific custom-made orthotic, right? So it's looking at it from that perspective of saying like, can we tolerate like standing on a hard ground? Can we tolerate standing barefoot on asphalt? Can we tolerate standing barefoot on rocks and things like that, right? So if you can tolerate those things, then now you have more options for movement. And if the culture always sort of pushes you towards avoiding, right? Avoid hard surfaces because it's going to be uncomfortable. Avoid abrasive surfaces because it might hurt you, right? That becomes problematic in the long run.
Okay. Yeah. That in the book you talk about really characterize physical independence in terms of movement options. Mm-hmm. And that made a lot of sense to me, but I hadn't necessarily thought about it that way before. I think in each of our own movement practices, we want to have more movement options. So maybe how the foot would deform around like a stone or something could be a natural response that we lose.
Right. And I think the word natural we have to be careful with, because like natural eventually is whatever your culture is giving you, right? So it may have been natural in a time where there were less options for supportive footwear, and when we had more things, more variability just in daily life. But right now it's actually more natural to have less variability of motion, right? And I don't think it's like a good or bad thing. It's just looking at it as like, this is what we are given. And not everybody's in that boat, but a lot of us in the culture, if we did nothing and we thought we weren't mindful of our movement, it would be very easy to just sit in the same chairs, wear the same shoes, right? Sleep on the same mattresses. So it would be very easy not to get much variability. So I think the idea of most of that topic of movement variability was just to promote some mindfulness towards the idea, and that's valuable. But we also have to be careful. Can't just jump into, stuff that you haven't done in a while, because that's also quite dangerous, for lack of a better term, because you're almost guaranteeing that you're going to create some type of physical pain or discomfort if you do something too quickly.
All right. All too often, tend to be eager to learn about how things are affecting us in ways that we didn't. I threw myself into a lot of things.
Yeah. And it's like that's a certain personality that can be valuable depending on how resilient you are, right? So if you really are just someone who's like exploratory, well, and you can throw yourself into the extreme of something and you can come back from it, then you may learn quicker. Like, so I don't think that's always a bad trait. It really just depends on how you view it. Like, so if you are someone who is very extreme and you're curious and you're exploring things, you'll probably have a better relationship to the fact that, oh, okay, I hurt myself, because you were extreme in the way you did it. But if you come back, like, you're not as harmed by the pains that you're causing yourself, because you look at it as a learning experience. But if you have a different expectation, right, where you think that, well, somebody told me that I should get more variability, or I shouldn't wear shoes, and then you hurt yourself, and then you blame the person who told, instead of thinking like, okay, be a little bit more gradual, right? That's a different mindset, and then you have a different thought process towards the pain that was created. Right. So that's it. There's always context around these things. Yeah. So I think it's important to know, what kind of learner you are. Like, if there's nothing wrong with being, kind of, I want to go after the thing, like the most intense thing, but just know that, like, there's a relationship to that most likely you're going to feel something you don't like, but maybe you get that out of the way sooner, right? If you're okay with that, and then you become a quicker learner. I'm, as a practitioner or a clinician, it's smart to promote gradual progression, right? Because it's not you that you're treating someone else. Right. You don't really know how they're going to respond to things. So it's safest to say gradual progression. That tends to fit with the physiology of the body, but everyone's a little different, and how you view threat, how you view pain, how you view injury, that plays a huge role on how you should approach learning something new. Okay, that makes a lot of sense to me. And I can see also with the blame, a person can be quick to also judge this new direction as harmful to oneself. Yep. And be discouraged from the start. Yeah. So it is a smart strategy for guiding people towards more movement options. A direction was something I was kind of curious about. Have you seen any common movement patterns in directions other than the forward-facing that have been lost because of our specialization? As a therapist, what you often see is certain patterns of movement that get overuse, right? And then you could backtrack from there and see certain areas that then get injured from that overuse. Okay. Right? So the moving in the sagittal plane, like forward for the most part, that tends to promote a lot of activity of like your hip flexors. It creates like a certain pattern where like the head and the shoulders might be a little bit forward because, we're moving forward. So it's more natural to be forward. And there's that word natural again, but it fits with like the idea of moving forward and also seeing forward. So if our gaze is forward at a computer screen or while driving, it brings us forward. So we kind of lose the proprioception of what's over here, what's behind us a little more, because we don't have to, negotiate that as frequently. So from a training standpoint, you want to make sure that you're doing things that appreciate all of those different directions and different planes, because it's just a way of balancing out the body, for a real generic way to say it. Okay. Are there any upward or backward? Yeah, the idea of play in general, right? Like, I think you can look at children, and when they play, they explore all different directions, right? So upward movement would be jumping. right?
Okay.
But it would also would just be like if you're running after something randomly, right? Or just trying to like play tag. Like you might move forward, you might move backward, right? Like there's all of this ability to go in any direction. And then that play, which is a little bit more random and it doesn't have a competitive element to it, meshes into athletic competition where if you have to dodge another person or you're trying to avert, then you're going to move in whatever direction makes sense in that moment. So it's never linear. It's not like four cardinal directions, like forward, sideways, and back. It's just like, can I move in any direction that the situation calls for? And then that creates the most variability. And that's what I was trying to get across in that chapter, that we are actually exercising as a society quite a bit. It's just that the more we get into sort of like these technological, using the technology of machines and things like that, a lot of times we will lose variability. But it's not that we're not active. We're just being active in the same patterns over and over again. Because that's kind of an easy thing to do after a while. Like the average population is, they have another job, but they know it's important to exercise. So it's going to be like, let's simplify by doing the same things over and over again instead of exploring new movements. And the point is just like that's going to be limiting at a certain point. So it is important to explore new movements and just make that a valuable part of your health.
Limiting at a certain point in the lifespan?
It possibly, but I mean that's not something I can say for sure. But it'll be limiting in the ability to do some of the things that you're going to want to do at an older age. Right. So when people are getting into older age and they're studied and they have like less speed of movement and they have a more difficult time getting up and down off the ground, which there's more variability of direction when you have to get up off the ground. Like there's different ways to get up off the ground, but like if you get up in multiple ways better, then that tends to show that there is some longevity numbers that are associated with that. Same thing with being able to get up and down from a chair quicker. That's measured with like a 30-second chair rise test a lot of times in research. And then like a gait speed test. Those tend to associate with like longer life. Okay. So part of that is speed, which I talked about, right? It's like varying up direction, but also varying up the tension your muscles create, which has to do with speed. Okay. Right? So that all of that is somewhere in the literature, right? It's just, it's kind of mixed in a little bit there. So I think you have to make some inferences, at least for what the current evidence shows now. But it makes sense that if like we can be hitting our numbers with cardiovascular activity, like getting our heart rate to where we are told to get it, but not vary up our speed, not vary up like our direction, and we'll still be limited as we get older with certain things that aren't involved in that, elliptical movement that we're doing or that bike movement that we're doing. So I think it's just important to look at that as like, that's only one piece. Like, don't not do that if that works for you, but like, just know what else you might be missing. That's going to be taken from you as your body starts to degenerate with age.
Okay. Earlier, training for a sport, but we're only really training in one repetitive way. We're also losing movement, or we're losing movement options there as well.
Right. So there's a ton of different types of sports, right? So the sports that have one task that you do over and over again, like running, cycling, they're going to have less variability in the body. And like to get good at them, you probably need to limit your movement variability in many ways. Like you need to train the thing that you need to get good at. And that's a different goal than a health goal of like more movement options or more movement quality. Right? So the idea of specializing to get better at something can have some diminishing returns over time, right? Just because you're fit in one area doesn't make you fit in the other areas, right? And it may actually take away from some of the other areas that are necessary in the long run for health and longevity.
So if we're talking about movement quality, then if you saw a study that was trying to, they used as a experimental variable, they used movement variability. A variation in movement throughout the day, rather than just a specific exercise session one time a week or maybe 3 times a week. Would you expect to see what would you expect to see just from maybe your experience and your intuition in how the movement quality would change, and also how that would affect maybe disease outcomes?
So I'll tackle that in 2 different ways. Like, one, I think, like, if you look at the totality of the research on physical activity, right, like you'll see that there is already research that touches on movement variability. It just might be called a different thing.
Okay.
Right? So that's sort of what I was alluding to, with that there's already studies that show that if you're able to move at a higher speed later in life, that's good for your longevity, which is a form of movement quality testing, although they're doing it with quantitative measures of timers and things like that. Right? There is a pretty well-known study now that came out of Brazil, like, that tested how people get up off the ground, like how many contact points do they need to get up off the ground. That's associated with longer life, right? So they're already out there, but they're different than the studies that just look at like general physical activity. It's all looking at like it as a prioritization model. Like it's better to move than not move, but then we might have to get a little bit deeper and look at what are some of the like important qualities that you want to maintain as you age. So I do think that research has already been done. It's just that you have to kind of look at it as a whole, and we have a pretty good understanding of the things that are good to try to hold on to as we age. Now, what I think would be interesting, and just from a standpoint of, say, like aerobic exercise or cardiovascular exercise, if you looked at a group of participants that did more just one exercise implement, so say like just did treadmill training for a certain amount of time, and you had a heart rate monitor on them and had them getting whatever the optimal heart rate for whatever the study was looking at, and compare that to a group that's doing a mixture of exercises that's also getting them in that same heart rate zone, but you're, instead of doing it with one exercise, you're doing it with, say, 5 to 10 exercises in maybe a circuit fashion, but you are now varying things up. Some of them might have resistance, some of them might be more low impact type exercises. You're moving at different in different directions and different speeds, but the variable that is the same for both is the heart rate, and seeing if there would be any differences in heart health or even just injury, overuse injury over time. That would be a study I'd be interested in seeing, and that would differentiate the two. But I do think there's already some research out there that shows like the things I'm talking about, at least with movement variability, like being able to keep speed in your training regimen. Like, don't be afraid of speed as you get older, because that's the exact thing that you need to keep, right? Don't be afraid of lifting heavy things, because strength is really important as you get older, right? And just not like picking one thing that feels good and saying like, this is my exercise, right? And I think that's what happens a lot of times. It's just like, I'm going to do the thing that I can already do, and I'm just going to do it more, instead of exploring doing new things or things that you're not good at, being a beginner again. So.
Yeah. Well, the beginner mindset and how our sense of vitality is tied to what we believe we can do. And like if we keep specializing in one thing and trying to make progress in that as we age, we are probably not going to make as much as we would like. But if we continued exploring different things, new things, starting from the beginning, we could see how much we can learn.
Right.
And that can be empowering.
Right. And I think ultimately you have to know where you're starting, right? And if you're sedentary and you're starting from that point, then you don't necessarily need to go as deep into the, like, I got to get all of these different categories of movement in. You just got to start moving. Like, you got to start the process. You got to get the momentum going. But there's already a lot of people that are moving a lot, right? And still having health issues, still having certainly like orthopedic issues, but also struggling with obesity and, metabolic disease. And, I think another piece of the variability thing is it makes what you do more enjoyable, right? If you're learning a new skill as opposed to just mindlessly going to the gym, it's a totally different experience with physical activity, right? And I think there's room for that in, our like trainers' mentalities of how they approach their job, right? Looking at it as being more teachers than motivators, right? Educators instead of motivators, right? So that you're going to take time to teach someone skills that they don't even know that they want to do yet, right? And it's important to know what those movements are, though, that are worth your time to teach them and worth their time to learn from you. And so that's certainly something I've gone through my whole career, is trying to, in different ways, educate people on why not to just do like the same exercises over and over again, why it's important to vary. And most of the time I have to be backtracking from someone's injury complaint, right? Okay. So it's like I get a lot of people that have injury complaints and they're fit. They have a routine that they've been doing for years, and they don't know why they're at this certain point in their life they're having trouble. And it's like, well, you've been doing the same thing for 20 years, right? Like, so you've got that thing that you're doing down. Let's try some other things, right? And it's almost like there's not even an understanding that there are other things, right? Because that's the general population, that's not their education, right? Like, that's our job as movement professionals to teach, like, no, this is a different way to look at it. This is a different way to categorize movement. So that's basically what like I was trying to get across with the book. And then as I get into like section 3 is really the specific movements and the reasons why I think these are valuable categories of movements to go after.
Okay.
So it allows for more triage of saying like, okay, what do we want to make sure we get in when we're doing a routine? So like if you get more skills that are actually more complex and you master them, like it's so much easier to stay fit than having to do like low level things and just do a lot of them. Mm-hmm. Right? So like the more complex the movement skill that you can master, and that doesn't really mean that you got to do a ton of weight or anything with it. It's just like, if you've taken the time to learn more complex movements and you can move at quicker speeds and you can like lift heavier weights if need be, well, now it's actually easier to stay fit, right? Like, it's easier to maintain your metabolism. Like, you're more versatile, but you could just get more out of every session you do of exercise, right? And I think that's the thing that it makes sense to me. It makes sense to, I think people that train that way, but it doesn't necessarily make sense to the person that's not in that industry or is just trying to somehow keep an activity process in their life while they're doing a ton of other stuff.
In that case, what is like an example of a more complex movement that you try to introduce people to, or you might introduce to a person?
So it might start at something as simple as like a squat pattern that somebody's coming in and is just afraid to squat because they've been told that it's bad for them, right? So that's more complex than sitting on a table and kicking an ankle weight up,
okay,
right? Or sitting on a machine and kicking, where like the machine locks you into one position and all you have to do is like one movement, right? When you're squatting, you have to coordinate balance, you have to coordinate joint range of motion, you have to coordinate and do it with multiple joints, right? So that's not an easy thing to just say like, go do it to someone, but it is a catch-all in many ways. Like, if you can get someone better at a squat, you're working on a lot of things all at once. And that's, chapter 13 is just all about like the different ways to look at squatting, because some people hear squat and they think back squat. Some people hear squat and they think like going to the bathroom in a hole, right? So it's all squatting in different ways. And there's different research that looks at squatting from different perspectives. There's squatting for power and strength, which is valuable. It's one of the best bang for your buck movements if you want to improve lower body power and strength, right? So it's good on that front, but it's also looked at for not fall prevention, but impact control if you were to fall. So if you can squat deeper, you have a better ability to mitigate the negative effects of a fall because you can drop your center of gravity better than someone else, right? So it's a form of weight shifting in many ways too. And then it's also looked at in research on, GI stuff with going to the bathroom, like people who go to the bathroom and like the idea of the squatty potty, and then in other cultures where it's just more normal to be in a squat, there's some evidence that looks at, like, is that valuable for, things that would lead to different GI problems. So there's a lot of different ways to look at the squat, but it would be complex for someone who is afraid to squat. So it's worth the time, though, to get them better at that, right? And that would, I would say, would be, that's one of the earliest things. That's like one of the least complicated things to work on, because there doesn't need to be a big speed element to it. It's more just, okay, can you get up and down from a chair, and then can we make that chair lower, right? We can use a wall, we can hold on. There's a bunch of different ways to get people more comfortable with the pattern that they were once fearful of, right? And then stuff that has a speed element to it, right? Like a kettlebell swing or anything that would be like a powerful type movement. That's a little more difficult to get people into. So oftentimes you need to kind of work the pattern slowly or focus on the static positions of a movement so that somebody just can feel it before things start moving really fast. And then you just gradually start adding a little speed. So anytime you add speed, there's more complexity in many cases. And that would be worth someone's time. But if they're apprehensive to that speed, then it is a more complex thing for them to have to work on. Just the concept of CrossFit, right? So that's an example there. It's a bunch of more complex movements mashed together. And if you take each one of those movements and you get people better at each of those movements without the idea of competition, without the idea of like trying to do it for a certain time, but you just improve all of the movements that are being asked of you, right? Olympic lifting, gymnastics, like, and then there's like rowing and all the things that like come into the aerobic capacity side of it, like learning how to run better, learning how to even cycle better. Like there's all these different categories of movements that you can get better at, but they are more complex. And so that people get hurt doing it because there's a lot of complexity, and it really depends on what your intention is there. Like if you're going in there and saying, I'm just going to take all these complex movements and I'm going to try to get a sweat and I'm going to try to get a workout out of them, instead of I'm going to go in there and look at all these complex movements and try to get better at each and every one of these movements. Well, I think the getting better at each one of those movements gives you a lot more ability to do whatever you want with your body instead of saying, I'm going in there to just like get a better time or get a sweat or get my heart rate up. You can choose to just say, like, I'm going to do this based on my level of readiness. I'm going to do this Olympic lift where I feel like I can do it. I'm going to do this deadlift exactly where I feel like I can do it, at the pace I feel like I can do it, not based on any timer, not based on any other person. Now, that doesn't often happen, but it's like you could choose to do that, and then having more complexity in your movement repertoire is a good thing, right? I can't see how that would not be a good thing, right? And then that gives you more options. But intent really matters. Like what your intent is for your exercise regimen really matters. So my opinion is that the intent, for the most part, should be to get better at more complex things. Be curious about that. Be curious about exploring things that you currently can't do before you start going nuts on just doing a ton of stuff that you can already do. Or like at least have two different regimens, stuff that you're exploring new patterns and then trying to build capacity on stuff that you're already good at.
Stick with it. So how do you kind of foster that, the curiosity about whether a person can do it and how they can get to that point?
Well, I mean, one, you gotta like read the person, right? Like, I think it's really important that, especially if you're working one-on-one with an individual, that you prioritize keeping them as a client. And I don't mean that in like a sleazy way that I'm like trying to like make money off. I mean, it's like they need time to trust you, right? So if you just throw all of your ideas at someone day one and they don't come back, you've done nothing good for them, you've done nothing good for you, right? So you need to allow people the time to trust you. So you try to meet them where they are and be patient over many sessions to try to integrate more things that you would find valuable for their overall health, right? But it doesn't really have to, it's not like it has to be this stuff that is just constantly frustrating people. It's really just taking a complex movement and breaking it down to what they can do on that day, but like keeping it in the context of the greater movement over time, right? So you also find what people can already do, and that's, you know, if somebody just is like fed up with learning new things and just wants a good workout that day, then you throw them into the stuff that they're competent at, and you know, you just, you know, up the intensity there. Like you can always do that on some sessions and then explore, you know, some more complex things on other sessions. But I do think it's important to have that in the back of your mind, that I have to work on the things that they currently can't do, right? Like, because you're not really helping someone unless you're changing like where their baseline is in many ways. So part of changing a baseline can be pushing, if someone can do 10 push-ups and you get them to do 20 push-ups, that push their capacity forward there. But another piece of it is just like, they aren't fast, right? They're afraid to move with any speed. I need to make them not afraid to move at this speed. I need to like introduce things that they didn't think they could do or they shouldn't do. And that's, I think, a bias towards me because I'm a therapist and a trainer. So I get a lot of people that they'll come to see me because they're afraid to exercise, right? And like the athletic population, you know, maybe a younger population might not come in with that type of starting point. But right. I tend to see a lot of people where they're been told over time, or they're just, for some reason, they're just afraid to do certain things because they've had injuries in the past, and they need a way to look at it differently. Like they need a better starting point, right? They need it to be less binary, not just like a squat is this, or, you know, moving fast is this. It's like, no, it's a volume knob, not an on-off switch, right? So oftentimes, like that's how you take what seems complex and you just make it easier. You just break it down, you deconstruct it.